Hi, I'm David Roy, and I'm the head of the Weinberg Family Cerebral Palsy Center here at Columbia University. In typically developing kids, the spine starts out rounded, and then with normal growth and development, as they start to stand and sit, the lumbar curves develop. In kids with cerebral palsy, that doesn't happen because of abnormal muscle pull, weak muscles, or asymmetrical muscles. In some cases, that can lead to spine deformity. Things like scoliosis, side-to-side curvature, or kyphosis, where the spine goes outward to the back, or lordosis, where the spine goes in toward the sternum. When those things happen and it interferes with function or causes pain, then we need to treat. Kids with CP need to be watched very closely. The more involved the child, the closer we need to be watching with clinical evaluation and x-rays. Once the scoliosis is discovered, we need to treat it. We need to evaluate and treat with physical therapy, perhaps with special seating, perhaps with a brace. And then if those things aren't working and the scoliosis is progressing, we need to think about surgery. Once we've determined that surgery is necessary, we have a couple of options. In the younger child who really needs to continue growing, we have instrumentation systems, rods and screws that will allow the spine to continue to get taller. That child can continue to grow either by us putting a magnet over those rods in the office or by returning to the OR for lengthening of the rod. As the kid gets closer to skeletal maturity, we choose to do definitive surgery. We use those rods and screws to get rid of the deformity, to maintain a balanced posture of the spine, and allow for sitting, standing, walking, and no concerns about future treatment of the scoliosis. Of course, not every CP child needs scoliosis surgery, but the few that do really need it. It prevents the complications of respiratory function and GI function, and in addition, it makes their lives better. When spine surgery is recommended for your child with CP, it's a scary moment. You're going to focus on the fears of complications, on the fear about the pain your child is going to go through, and that's okay. But you also need to focus on the outcome. You need to understand that that child's going to be more comfortable and have a better quality of life.